They've been involved in flight broadcasts.
So welcome everybody to the Provincial Practice Facilitator Network webinar for October 5th. My slides don't want to move around. There we go. So just a treaty acknowledgement. We would like to recognize that we are webcasting from and to many different parts of Alberta today. The province of Alberta is located on Treaty 6, Treaty 7, and Treaty 8 territories, and is a traditional meeting ground for and home to many of our Indigenous people. We also have a privacy disclaimer. We are recording this webinar for quality and training purposes, for it to be posted on our ACT collaborative site for the purpose of learning. By participating in this session, participants are consenting to the recording, and it will be available on the website for an undetermined amount of time. And this is just our Practice Facilitator Network vision, mission, and values. And I think everybody is getting to know those now, and for time, I'm going to continue. Today's webinar is the Practice Facilitator Competencies in the Modes of Influence. So today, we're looking at help. PIA does not mean what I thought it did. And we have a little video here that maybe would seem familiar for how you might feel about CII CPAR and privacy impact assessments.
Chalubi, baby. Good morning, Roz, my succulent little garden snail. And who would we be scaring today?
Wazowski, you didn't file your paperwork last night.
Oh, that darn paperwork. Wouldn't it be easier if it all just blew away?
Don't let it happen again.
Yes, well, I'll try to be less careless.
I'm watching you, Wazowski. Always watching.
Whew, she's nuts.
If everybody else feels this way when they're looking at privacy impact assessments. So today's webinar, again, is around privacy impact assessments, and it is a collaborative that came together to present this webinar today. Sandy, Laura, myself, Ingrid, Brian, and Chris. And so I'm going to turn it over to Ingrid Rise now, and she's going to talk to us first. Ingrid?
Thank you. So I'm here to talk a bit about the privacy impact assessment. And as the opening line said, a PIA is not what I thought it meant. And for those of you that thought it meant pain in the ASS, you were probably close to right, but the truth is it is a privacy impact assessment, and we'd be happy to show you how easy it is. So a PIA background and overview, current state, the format, the components of a PIA, clinic privacy program advantages, and then any questions or feedback. I talked fast. I was given 5 minutes. So bottom line is a PIA is, again, correct acronym, privacy impact assessment would be the right word. It's due diligence. It's really examining the impact organization-wide on how your practices affect privacy, and to ensure that it's a thorough analysis, that you're mitigating all your risks, and what kind of impact will this change have on your system or business processes, on an individual's privacy, and that you assess and address changes according to legislation, which I think is logical, and of course your policies and procedures. I'm already, do you want me to turn the slide? Just kidding, I can't. I'm on the next one already. So in a recap, oh, sorry, Charlotte, or whoever's moving the slides. The next slide says that bottom line is these are the components of your privacy impact assessment that you can sit there and you have, you know, your organizational wide. Can you describe it? I don't know if some
Ingrid, it's
stuck. Well,
Yeah.
there's a clue in that. This is how a lot of people feel about it. Just
Charlotte, I'll bring my slide deck up if you stop sharing.
Sure. Well, we could hang on a second, Ingrid. I think we're okay through that first 5 minutes pretty fast. So extend you a couple of grace minutes here. So.
Oh, that's too bad because usually I like to talk. So
it's coming.
It's all good.
Yeah, sorry, I had it up here and it's.
Really? That's the question? Does anyone have a good clean joke? Are you implying a PIA wasn't a clean joke? Because I even spelled it out instead of saying it.
Yeah, well done, Ingrid. I was hoping you wouldn't, but.
I didn't want to make any CLM, any career limiting moves quite yet.
Yeah. Okay, I think we've got Leanne's screen coming up here. Oh, she had to recover the document. So there you go. Technology.
Awesome.
Finest, yeah.
Perfect. So I'm already on the next slide. Not that that matters too much, but if you could. So like I say, this PIA is a system and practice, your organizational privacy management, health information flows and legal authorities, your risk and mitigation, and then of course, how you're going to continue to monitor, review, and stay in compliance. So guess what? I knew you want to know, so I am going to tell you how it works. I'm first going to tell you what it looks like right now. So let's pretend you're a physician and surgeon and CII comes knocking at your door. You're like, this is lovely. Where do you fit in on this graphic? So for example, if you have an EMR, well, you have to write a PIA for that. Or for any add-ons, your mobile access, your virtual visits, your online booking, your patient portal. But worse yet, here comes the province knocking at your door and say, okay, do you want e-health? Do you want to belong to Netcare? Well, make sure you have an up-to-date PIA. And here's our Netcare expedited PIA. Same as CII CPAR. Luckily, we do it in a letter acknowledging that we're signing on to what work has been done on our behalf. So you can see that as a physician, you're faced with all these PIAs for every time you literally, oh, let's be careful here. Every time you bring on a new system or something that is going to affect the way you do business. So, sorry, next. I hate having to say that. This is what your current PIA format looks like. And you can see for a lot of people, it's rather intimidating. So a cover letter, easy breezy cover girl, I can do that. A cover page, again, not a big challenge. But now you get into the project overview, your privacy management, your project privacy analysis, your risks and mitigation plans and your policies and procedures. And a lot of times just looking at all that is overwhelming. Yes, I know some of these things are from the 60s, 70s, maybe even 50s. You guys will get over it. So next. So in there, your organizational privacy management, you have to be able to explain how you manage all your privacy compliance. Do you have a privacy officer, maybe a privacy and security officer, or maybe you've got all three, and an access administrator who's running your, Netcare, who's your access administrator for your roles, your policies and procedures. Do you have your access and your correction or expressed wishes? What about your breach responses? Is that all in order? This all is a component of your organizational privacy management. How about your training? When's the last time you even went for privacy training, if ever? Can you say confidently that your staff all understand and have some kind of privacy training so that they know better than to just go look up their, cousin Fred, who you heard had a, well, I guess he can't have a hysterectomy, but that you heard he had, his hemorrhoids removed. You can't just go on Netcare and look that up. So those kind of things you should have in a training so that the staff all understand, what you can and can't do. And then next is going to be things like your information flow analysis. Can you explain where your health information came into your system, who is sending it, how it's transmitted, how it's secured? What are you going to do with it when you have it? Where are you going to send it to? Are you sending it through hotmail.com? Like, what kind of security do you have, how you're sending it? And so all of these answers actually build your information flow. So it looks complex, and I'm not trying to scare you, but you have to be aware that these are things that you need to pay attention to when you're writing a PIA, so you're not glazing over. Oh yeah, well, you know what, we have Billy Bob's most excellent EMR. It's great. What's the password to get in? Open. Or, there is no password. You don't need one. So all those things are very important, and it belongs in your information flow to make sure that you're actually protecting your information. Next, you're going to see my favorite part, the legal authority and purposes table. So you need to be able to see that you're doing things that you're allowed to do, and how can you prove that you are allowed to do it? So you can't just say, well, I'm doing it because I'm a doctor, so I have every right to do whatever I feel like. Well, it doesn't work that way. You have to be able to cite your sections to be able to say, I'm collecting, using, or disclosing information based on this section of the Health Information Act. And so all these things need to be considered when you write a PIA. See, I'm almost done, and it's almost 5 minutes. So your risk mitigation plans, again, all those information flows, you have to be able to see what kind of risks, almost always people, but there's vendor, technologies, how many people are all accessing your EMR, all those things are a risk. And so you need to make sure you have the proper mitigation plans to address your risks. Solutions, if you have incident or breach management, you have solutions, A, to prevent it, but B, to help triage if there is an incident. So you have your PIA, you can do a security assessment, a threat risk assessment, like identify your gaps and address them. Put them in your policies and procedures so you can demonstrate this is what happens if we have an incident, or this is how we do business, this is how we're protecting your privacy. Oh, sorry, that's a habit. So section 8.3 of the regs, health information regs, say custodians must periodically review the safeguards. And that is to ensure that we're protecting health information. So again, PIA, a security assessment, risk assessment, and make sure you're assessing the physical, administrative, and technical safeguards when you're addressing a PIA and when you're trying to figure out where you're going right or wrong. Hopefully you're not going wrong, but yeah, some do. So how do we keep the focus on privacy? Because guess what? You never guess what my day job is, but we want to keep the focus on privacy, and we realize that when you do one back in 1910 or whenever you did your first PIA, it isn't current anymore. So how do we keep the focus on privacy and keep coming back? So the way is on the next slide, you'll see that it's kind of like a privacy management program, right? So, and I can't call it a PMP because it has another meaning. But what you see here is this program is got a structured setup, because your policies and procedures, once they're implemented, that's a continual privacy checkup. Now your roles and associated training, that all circles in and out of your policies and procedures. So everybody is clear on what they do, how they can be assisting in protecting privacy. And of course, the training that goes with it just reinforces those things. Then you have your safeguards. You know, all of this leads to the tip of the pyramid, which is an up-to-date PIA. Now, is that the only thing? That isn't a one and done. That up-to-date PIA, because you're continuously updating your policies and procedures and making sure they're relevant and current, that keeps triggering your PIA staying up to date. So it's almost more important than the actual, of course, you have to file to let them know, but it's almost assisting in knowing when to keep it up to date and when to file it. So the next slide shows you a little more logical in my mind. It's like a puzzle. So the PIA is just a piece of the puzzle. You have to have all your agreements in place. You need to make sure those safeguards are there. You need to make sure there's a training and everybody understands their role and their role in protecting privacy, but their role in the office too. And then of course your implemented policies and procedures, make sure they're monitored and they're updated as appropriate. I have jokes on, too bad I'm not allowed to tell. So that assessment piece is really just one piece of that puzzle. Your EMR is a piece. How you're collecting, using, and disclosing is a piece. Your provincial initiatives, your security, your agreements, all of these form the PIA puzzle. So it's not difficult. And if you tackle them a piece at a time, they fit together nicely, in my mind. And I think I'm done. I'm trying to remember. Oh yeah, I am. See, if you, my name's on every bathroom wall, but free, so is my phone number apparently. So feel free to call if you have questions. I'd rather help you walk through than have a breach or have an incident. And my email is there as well. Thank you. Any questions, by the way?
Thanks, Ingrid, for your quick overview of the complicated PIA. So
thank you.
Next, we'll go on to Brian Hamilton, who's going to go over.
Charlotte, can I just ask one question?
Sure.
Are you able to give that information to the physicians as well, your contact information, Ingrid?
Yeah, like I say, it is on every bathroom wall.
Perfect.
Thanks,
and I really am joking about that. It better not be.
Okay, Brian?
Hi, thanks, Charlotte. Thanks, Ingrid. So I'm with the Alberta Health e-Health Support Services team. So I provide privacy strategic advice to them. I'm also formerly of the Privacy Commissioner's Office. So I worked there until about 2016. So that's my background. So I can kind of give you an insider's view of the PIA process, but so when we have questions later, we can certainly do that. What I'm going to take you through, along with my colleague Chris, we're going to take you through the Netcare PIA process for CII CPAR. So it's a little bit different, and it's an abbreviated, simpler process. Now, what Ingrid has done is she did the hard part. You've already got your PIA done because you followed her advice, and you submitted it to the Privacy Commissioner's Office. They've reviewed it and accepted it. And now you are thinking about joining CII CPAR. So let's go to the next slide. I'm putting up the CII CPAR PIA process in brief, just to put this whole thing in context, and then I'll go into a little bit more background on each of these points, and really, give you a sense of what Alberta Health is trying to accomplish here, why they're doing what they're doing, because I think that's half the battle in understanding. So when you decide you want to participate in CII CPAR, of course you go through that regular, intake process. You confirm your participation through that confirmation of participation form. You make contact with facilitators, and there's a clinic contact or a site contact. One of the first things that our team does is we will conduct a privacy impact assessment, risk assessment, right? So we're assuming you already have a PIA for your electronic medical record in place. And our team does this, so you don't have to worry about it too much. So there are 3 possible paths forward. So if your PIA is up to date, and we'll talk about what that means in a moment, then you're good to go. All you need to do is sign that CII CPAR endorsement letter and proceed. It's very simple because you're relying on work that Alberta Health has already done to describe the CII CPAR system. You might be in category B there, where you have to make some minor changes to the PIA. Now, that doesn't stop you from participating in CII CPAR. You make a commitment to make whatever small changes our team advises you to do. You do that in parallel, and you've got 12 months to get it done. You just go ahead with CII CPAR in the meantime and make a commitment to make your PIA updates to the Commissioner's office. And our team does come back and check to make sure that you have done that, in fact, and that those updates have been accepted by the Commissioner's office. And if you're in that third category, you might have had some major changes to your privacy impact assessment. We'll talk about what that means. You would have to make those changes and submit your PIA to the Commissioner's office before you can participate in CII CPAR, before it can be implemented at your site. Now, in all of these cases, we're not waiting on Privacy Commissioner acceptance of the PIA, right? So we're still proceeding, either based on your commitment to make some minor changes or your actual submission to the Commissioner's office. So let's go to the next slide. So that's the overall context. That will give you a little bit of background. You may have seen this before when you plugged your phone into a computer. I like this analogy here because this gives you a sense of what we're doing, but it's on a smaller scale, right? So you plug your phone into the computer, it asks you, do you trust this computer? And it's very similar to what Alberta Health is doing. By knowing that you have an up-to-date PIA in place, they know it's okay to trust. There's a mutual trust relationship there, that they know it's okay to hook you up to their stuff, basically, to hook you up to their systems. And so by ensuring that you have an up-to-date PIA in place, Alberta Health is doing its own due diligence, which the Privacy Commissioner, wants it to do as well, to make sure it's okay to proceed with hooking up a custodian site to its systems, to Netcare by way of CII CPAR. We'll go to the next slide. So, I think Ingrid already covered this, so we can just jump over this pretty quickly, but, there is a legal requirement to revisit all of your security controls. What you submitted in your PIA back in 1910, as Ingrid mentioned, may have changed over time. And, you need to make sure that your mitigation plans are still effective. The law might have changed and so forth. So this is another reason why you should be updating anyway. And this is just kind of a broad requirement beyond whatever Alberta Health has established for CII CPAR. So go to the next slide. So what do we mean by an up-to-date PIA? So in one sense, it's really simple. An up-to-date PIA means it reflects your current system and infrastructure, and your Health Information Act policy attachments that you originally submitted still reflect your current practices and current legislation, right? So that's that whole pyramid that Ingrid showed you. Is that stuff all still current? Now, if you want to take a look at this on your own, let's say if you're talking to someone before they've decided to participate in CII CPAR, there is that PIA self-assessment tool on the AMA website that people can use, and that will actually take them through some of the reasoning. Have you got a small change or a big change, and what do you need to do about it? Do you really need to send an update to the Commissioner's office? And certainly, you can contact our team as well if you want some advice on that point. So next slide. So we don't have to go through them all. You might have some specific questions after I'm done. Now, these are changes that likely trigger a PIA update. So, obviously things like adopting a whole new system, but even adding things like virtual care, like we have at the bottom of the list, those are things that would really require you to update your PIA. That doesn't necessarily prevent you from participating in CII CPAR. Remember, as I mentioned, there is that middle path where you've got this middle level of risk where you can, make a commitment to update your PIA, get in the hopper to be implemented for CII CPAR at the same time, as long as you go back and make these updates. So there are some relatively minor updates that are kind of quick that you can make. You know, with the advice of our team, we can give you some advice on how to do it. But those not necessarily going to stop you from going ahead with CII CPAR. If your PI is wildly out of date, like you've adopted a whole new system, and you haven't sent anything into the Privacy Commissioner's office, you're going to have to take a pause and submit a new PIA basically to the Privacy Commissioner's office at that point. So let's go on to the next slide. You know, and here's the other side of the coin. Unfortunately, it's not quite as long a list, but you know, here are some changes. You know, you probably don't need to do a PIA update really. You know, like routine upgrades and patches, your operating system, little improvements, security patches. These are the kinds of things that happen all the time in system maintenance. They don't really require a whole new update going into the Privacy Commissioner's office. So just so you know that. Next slide, please. So we had a couple of questions coming in, and you know, there was one that's, you know, how do we do an update? And that's actually probably at least a 2-hour seminar. I know the length because I've done that seminar, and we've actually got a recording for you. If you want to download it and watch it, you can watch it in 15 or 20-minute segments on your own time. It's also linked off of the AMA website. But really, you know, the short part of that advice is you use the OIPC PIA requirements guideline that Ingrid showed you a picture of it in her presentation. You can download it from the Privacy Commissioner's website. You go through it section by section. You have your old PIA, you have your new PIA, and you simply describe what's changed or what you've added. If you've got a whole new system, start over. Don't bother calling it an update. But if you're just adding things to your previously accepted PIA, then you can kind of just describe your additions. Some custodians actually will do almost like a red line. They'll get their old PIA out and you know, use track changes or something and just say, okay, this is the new stuff. And then the OIPC can very quickly see what's changed. So you can do that if you like as well.
Ryan, how often should a PIA be reviewed?
We recommend that you review it every 12 to 18 months. That doesn't mean that you submit an update to the Commissioner's office every 12 or 18 months. That just means that you go through it yourself and you keep it up to date. And if you have a significant change, right, like we've talked about, then you should send an update to the Commissioner's office. But a lot of people think that there's like a mandatory requirement to submit your PIA every 2 years. And that's just come from a rule of thumb at the Commissioner's office and to some extent at Alberta Health, where if you're going to rely on an older PIA to support a current initiative, so like you're relying on a PIA you submitted in 2015, right, to support your current participation in CII CPAR, you will start getting some questions from the Privacy Commissioner's office or Alberta Health if that's a PIA that's older than 2 years old, just because they're figuring that, well, after 2 years, something's probably changed. You probably should have done an amendment. So they'll start asking questions. So that's where that whole 2-year rule of thumb has come from, but it's not hard and fast. I mean, it's conceivable you could, you know, have a PIA that you did 3 or 4 years ago. You've been reviewing it every year and nothing's changed. It's possible. But the more time goes by, the less likely OIPC and Alberta Health are, you know, going to be to buy that assertion that nothing's changed. Another question we had is what happens after the PIA endorsement letter is sent in? You can, you know, there's really not much, you know, behind the scene. Chris from our team will talk a little bit about some of the stuff behind the scenes, but at the Commissioner's office, there isn't much. All you need to do is stand by to hear from the OIPC, and then you can begin working with our team. As I said, you know, you don't need to wait until your PIA is accepted to begin working with us. You know, just get the process rolling with our team. We'll help you with the risk assessment, And a lot of your PIA update work, in a lot of cases, can simply proceed in parallel. So let's go to the next slide. So here are some resources. This is from the AMA website, so I think you should be familiar with this stuff already. But the stuff that I put a box around, the EMR PIA information for clinics, that's a newly updated FAQ. That kind of lays out all of the process that I described. There's a link to the PIA self-assessment that people you work with could do even before they participate in CII CPAR, just if they want to get a sense of whether they really need to do a PIA update. There's that seminar I mentioned, it's linked off the website. And then Alberta Health has recently published an annotated PIA template. So if you're updating certain sections of your PIA, you can refer to this, and Alberta Health has some really good guidance there. Just below that box, the breach reporting links, I'll draw your attention to that as well, because that is the most common issue right now with people's privacy impact assessment policies and procedures. So you attach those to your PIA. And back in 2018, the Privacy Commissioner was still accepting some PIAs if they didn't include mandatory guidance, but those days are over. If you submit a PIA to the Commissioner's office and you're referring to policies that are kind of old, like older than 2018, they're going to be asking questions about whether you have updated them to include the mandatory privacy breach reporting provisions that were put into the Act in the summer of 2018. So you have to make sure that your policies reflect that. And that's the most common issue we're seeing on our team, where policies are out of date. So it's also good to have that information handy for you. Let's go on to the next. There's just our contact lines. That's our team, eHealth Support Services, and you can contact the OIPC or the Alberta Health Information Act Help Desk if you have questions on legal interpretation. And I think we'll move on to the next part, which is my colleague Chris. Or were you going to do that after?
You know what? I think we'll go on to some of the questions that we got sent in to us, Brian. Thanks very much for that. And I know Chris has sent me a couple of slides for some of this. So this is really helpful. I think the more that we hear about this, the more we start to understand it. And as I said, it does feel very complicated. So just go on to the next slide, please, Leanne. So here's a question that comes up quite often, because we're working outside of the clinic. So most of us as practice facilitators are not embedded in the clinics. We're sitting separately from the clinics. So working for the primary care network. So one of our clinics, say, can't find their PIA since moving clinics. How do I find it for them? Would I be able to go in somewhere and find that PIA for them?
Yeah, there isn't any kind of online repository of PIAs that you can easily access. The OIPC, the Privacy Commissioner's Office, they have copies of those old PIAs. You can call them and ask them for a copy. And I'd be interested to hear online, if there's people online who've had experience doing this. They might give you a hard time. They're not too happy about it, because in their mind, they see that as a sign that no one's been paying attention to this if you can't find your PIA. So, you might get a bit of tood, shall we say, from the Commissioner's office if you request your PIA. But I think ultimately, they should give it to you. They might slow walk it a bit, which is unfortunate, but they will give it to you. One thing though, Ingrid and I were chatting earlier by email, and if you've got a really old PIA, and let's say it's so old that your system has changed, you've got a completely different EMR or a vastly different version of it, you might be better off just starting over rather than waiting on them to pull your PIA out of cold storage. So I'd be interested in hearing from the group, like, what are your experiences if you tried to get a copy of your PIA from the Commissioner's office?
So we see we have one response to that, and that's from Margot in Red Deer, and she said that it was that was their experience a couple of years ago when they requested it. And another one said it was a very slow process. I'm finding with one of the clinics that they're trying to get it. So you're bang on. It sounds like, Brian, that we kind of get slow tracked and into getting those. I mean, even sometimes getting the file number. I know as part of the business renewal plan for the PCNs, we have to include updated PCN numbers, the file numbers, and get those even from clinics. They're going, oh, I don't know what's my file number. And so it would be nice if there was one place to even go and find those updated file numbers. And I'm assuming that the OIPC would have that as well, just the numbers.
Yeah, they have that. If it's an old PIA, there's a published, listing of PIAs on the commissioner's website of historical PIAs. It's not the easiest thing to search through. I think it's a PDF of an Excel spreadsheet, but they do have it there. But you're kind of up against the fact that they really think that it's the custodian's job to keep on top of it, not theirs. So that's not really good customer service on their part, perhaps, but you can see where they're coming from is that, that it's like, this is something that, custodians should be tracking, not necessarily them, especially if it's really old stuff. I think they actually have to go back to things that are stored off site at Iron Mountain. So it's a bit of effort for them to track these old things down.
Yeah, anyway. For sure. Yeah,
and I'll send you the link, Sandy, so that you have that. And then you can send it out. Thank you.
Okay, that's great. Thanks, Ingrid. Like I know sometimes when we say it's the custodian, but we know in clinics that it's actually the clinic managers that are responsible for that PIA. And I think what we're finding with CII CPAR is we sometimes get that glazed over look. And so the more support because we tell them that this is something you're required to have regardless of CII CPAR. And so the more support they can get to get that PIA updated, the better off they are. And but I think it's something that causes a great deal of anxiety with everyone.
Absolutely, yeah, I understand that.
There's another question, Laura, I'll just grab this while we're here, from Charlotte. And she said, if you start over and don't put the old PIA number, can that also be a problem?
Shouldn't be.
Shouldn't be.
No. I mean, if you've provided a complete description of your system and you've attached your policies, it really doesn't matter what you previously said. And you could just say, this is a new submission, and it basically overwrites anything we've previously submitted. This is our PIA going forward. So in fact, by stating that quite emphatically in your cover letter, then they probably won't feel like they have to bother going back and looking up your old PIA. So it makes it quicker maybe for them to initiate their review.
Okay, excellent. Anybody else who wants to chat in any questions? We've got another one. What is the cost associated with creating a new PIA or sending in an extremely old one?
You want to field that one, Ingrid?
There is no cost. From the OIPC perspective, the only cost is if you take on a consultant. However, there is no reason why you cannot write your own PIA. And if you have an old one to go by, that just sort of enables you to write your new one. So technically there is no cost, your time.
Excellent, thank you. And we can just go on to question 3 as we're waiting for that to come in. I think we answered that in the presentations that you did already. Here's another question though. In general, how many pages is a completed PIA? How large is the document that clinics are trying to locate? And I think that's a problem for everyone. They don't know what they're looking for.
Yeah, it could be kind of a long document. I mean, there's really 2 components. There's the description of your EMR and the security controls, and that may not be too long. That might be 15 or 20 pages, maybe less, depending on how succinct it is. The thing that's quite long often I find is the Health Information Act policy manual. And that could be, 40 pages, depending on how long, how much white space and so forth. But so it could be quite a thick thing if you're actually trying to find it. I've always maintained though that if your privacy manual is 40 to 50 pages long, you're not trying hard enough. You should really make it shorter, or at least try to break it up, or have sort of like a front desk version that could be like 10 or 12 pages, something really easy, and then sort of more detailed stuff for the actual clinic or PCN privacy officer. But anyway, it could be quite a thick piece of documentation if you're hunting for it.
Yeah, and just so you know, the old POSP ones were 380 pages long.
Whoa!
So I said
That's
the old
crazy.
POSP.
Yes. All right. Wow. So just so I can make sure that this question is clear that came in, how do we know if they have an up-to-date PIA? And I'm going to say that self-assessment would that be the most accurate way to find out if it is up to date?
Yeah, I think so. It takes you through the reasoning, right? So it'll take you through, some of the questions are derived from that listing that I put up there, like, have you changed EMRs, right? It starts off with that and takes you
Added a new
through
provider.
other things, right? And, have you reviewed your policies to include latest, changes from legislation, right? That I talked about from 2018. So, if you're answering, yes, we've changed our EMR, and no, we haven't updated our policies since, 2012 or something, then yeah, it's time to do a PIA update, or maybe just a net new PIA, depending on the extent of the change. Like I would say, if you've changed your EMR, it's a new PIA. There's no question about that. If you've added some things on to an existing EMR, then you're probably more in the realm of an update.
Yeah. And new providers would just be an update then as well.
Yeah, I guess it depends on what you mean by new provider. Sometimes the vendor ownership just changes, but you've basically got the same system, or you've changed completely systems because you've got a new provider, then that's a little different. Yeah. Or are you talking about like a new backup provider?
No, I think I was referring maybe a new physician or a new
provider in that sense. Yeah. Those are minor things for sure. You can provide that's the stuff where I would say, you can send that to the OIPC if you want to, as needed, just so they have an up-to-date file for you. But, for the purposes of CII CPAR, that's just a minor update. And, we just advise you to send in up-to-date information as you proceed with implementation.
Excellent. And the next question, please. I think we answered this too, talking about that it would what process needs to be followed for amending the PIA to add virtual visits.
Yeah, so that would definitely be an example. So you add virtual visits to an existing EMR product, or maybe it's like a separate new, you might be using a separate system for the virtual visits. I would expect that you would need to describe whatever technology you're using for the virtual visit, plus the security controls associated with it. And you should also have some new policies to describe how you're going to use virtual visits. And maybe there might be some new information that you provide to patients as well. So those are the things I would probably expect to see in an update that covered virtual visits. Do you want to weigh in, Ingrid? You might have actually done a few of these.
Maybe quite a few.
Yeah.
But basically, it would trigger at a minimum an update, at a minimum. So if it's, let's say, TELUS virtual visit on top of a TELUS EMR, that's a lot easier marriage than it is if you're using Zoom, which would need one, and then your IMA, like all the things that go with it. So it's easier to follow a process and a checklist to amend your PIA to add virtual visit.
Excellent. Thanks, Ingrid. Okay, I think we'll go on to the next question, because I know Chris has some slides coming up here too. We want to make sure we get to. So we know that TELUS Wolf is going to be no more in the next little bit. And so they're going to be moving to another EMR, those physicians that are on Wolf. So what do we do as far as enrolling them in CII CPAR? Obviously, it's going to need a whole big update to their PIA. So what do we do when it comes to CII CPAR? Do we get them enrolled, or do we wait until they get moved over? And I think that's supposed to be happening in November or something.
Well, before he speaks, in discussion with TELUS, they are moving Wolf as their first transition, but they actually haven't got it all figured out. So they will never be able to get all of Canada moved over anytime soon. So if you're holding your breath, waiting for this to happen next month, it's going to be a swing and a miss.
Okay, yeah, that's good to hear.
Months and months, if not years away.
So go ahead and get them going.
2023. So that gives you sort of, okay, just.
Okay, great, thanks, Ingrid. All right, and the next question, Leanne, please. Okay, now I know you answered this, Brian, and so we know that we get that endorsement letter sent off, and you said that the next thing that happens is that the clinic is standing by waiting to hear from OIPC, and you just start working towards getting them enrolled in CII CPAR and working with them. And I guess what we don't see, and I know, Chris, you've got some slides coming up for this one too, we don't see actually what happens at the clinic level when we're sitting at the PCN. So we're not sure what happens to that PIA. So do you want to maybe go to the next slide, Leanne? And I think Chris has some slides here. Maybe you can speak to that, Chris. And if you're speaking, you're still on mute.
Skip. Oh, there he is. Nope, can't hear you, Chris.
Nope, still can't hear you, Chris. We could hear you at first. No, not yet. Lori, do you want to go ahead and just do your question while we're waiting to get Chris back up and running here?
Yeah, for sure. So I feel like Wolf and the Wolf transition is still going to be a barrier for most practice facilitators. So we know that TELUS has committed to those clinics who are live on CII CPAR with Wolf, that those clinics that transfer to Med Access will have a seamless transition of CII CPAR. But Brian, I heard you say, I think earlier it said it would, new EMR would trigger an update, but it would actually trigger a whole new PIA. What is the work involved in that section? Like, how could we entice a clinic to do an update for Wolf when they have a whole new PIA on the horizon when they do their shift to a new EMR?
Well, yeah, how can you entice them? I guess the CII CPAR might be the enticement, right? If they wanted to get on it right now. When they switch over to whatever new EMR they're using from Wolf, I mean, they absolutely have to do the PIA, a new PIA at that point. So I think it might just be a matter of timing, right? Like when is your site going to do that? Ingrid mentioned, and I've heard the same thing, that TELUS expects to be done with the transmission in 2023, transfer in 2023. So there's quite a bit of lead time. You might only have a very small update to do right now, right? You never know. It would be good just to maybe take a look at that self-assessment, go through it quickly, review your own PIA. If you just have a couple of things to tweak, maybe make those small changes and go ahead with CII CPAR. I guess it depends on the extent of the change that you need to make. The other side too, like not to use the hammer, right? But if you have significant changes in your EMR, you owe the Privacy Commissioner PIA, whether they happen tomorrow or whether they happened 2 years ago. Your clinic's out of compliance with the Health Information Act if you're not informing the Commissioner of changes. So you know, that's the downside, right? If you had a privacy breach or a complaint from a member of the public, your PIA is out of date, then that's one more contravention of the Health Information Act piled up against your custodian.
Thanks,
And
Brian.
TELUS will have a bit,
Oh, sorry, go ahead.
no, I was going to say, I also believe TELUS has a bit of an obligation here to demonstrate how they're going to migrate the data, how they're going to do this securely, and they will have an obligation to provide you as a custodian that information as to how they're doing it securely. So it's not going to be just the clinic left high and dry. They have an obligation to demonstrate that as well.
That's right. And they should be providing that information directly to you.
Yeah.
Excellent. Excellent. Thank you. Chris, were we able to get you back?
I think so. Can you hear me now?
You bet we can. Thanks.
Perfect. Okay. So if we go back up one slide, I believe that's where it begins. Are you able to back up one slide?
Leanne, can you go back one slide?
Perfect. Okay, so part of the endorsement letter is part of the participation package, which comes from eHealth Support Services. So every clinic is going to be assigned with a consultant from eHealth Support Services. It's not a member of the intake privacy and security team. So once you have already gone through intake privacy and security, you have been assigned either like a risk level, so minor, major, or PIA is current. So once you get past that stage, you are given the clinic is emailed a participation package. That package contains an endorsement letter. It's a blank template. It contains a panel request form and a CPAR access administrator form. So those three things need to be filled out at the same time, and they're submitted to the implementations team. That endorsement letter also goes to the OIPC. There's a QA that happens on those forms, as you can see below the line there. So the dotted line is shows the difference between what the clinic does versus what happens in the background. I think we lost the slides there.
Yeah, we did.
Okay. It's okay, I can keep speaking to it.
Okay.
So there's about 2 day period, 1 to 2 days where the eHealth support team QAs those forms. And the clinic will get a reply back if something is wrong with those forms. So oftentimes the endorsement letter might not be carbon copied to all the providers in the clinic, or the panel, we find that the PRAC ID is usually incorrect. That can happen. So it's basically screened once over before it's processed. And if the clinic does not get a notification back in about within 2 days, you can safely assume that the forms came through okay. Then they get processed. The CPAR access administrator is created in IAM system. Alberta Blue Cross gets a copy of the panel request forms. And the elapsed time is now probably about 5 to 7 days. And the clinic is going to start receiving emails. So one of the emails they're going to get is an automatically generated email from the IAM system, which contains all of their panel IDs. The eHealth Support Services team also tries to time that email with their two configuration and activation instruction emails. So you're going to get an additional 2 emails from the consultant who's been assigned to work with the clinic. And there's a lot of information packed in those 2 emails about what needs to be done to configure the EMR system. So the clinic will then use the information that was provided to them to configure their EMR. And at this point in time, they have enough information to complete the panel administrator form because they have received the panel numbers. So if we can go to the next slide, please. Next slide, please.
To have a delay, there we go.
Okay. So when the clinic configures their EMR, there's a bit of a scheduling component here as to when we want the clinic to go live. Normally, eHealth Support will give the clinic about a 3-week window to do this activity. The dates are provided to the clinic, and if the clinic cannot meet that schedule, the clinic should notify EHSS to say we need more time. Because what eHealth Support Services is doing at this point is letting the vendor know what the go live date, and the vendor has a lot of back-end activities to make sure everything is exported properly, and we'll work on the go live date. So it's important that the clinic lets us know if they cannot configure the EMR by a certain date. And then the next step is the clinic will go live. So when that date comes, the EMR is turned on in the back end, and data will begin flowing. Now, what you can expect is that if you're just submitting encounters and panels, i.e. no consults, it'll go directly to Netcare production. But if there's a consult report component in that submission, it has to go through testing first, and that's an AHS requirement. So what's going to happen is the information will flow to a test environment first. There'll be another probably 3 weeks to a month of testing to make sure the consult reports are rendering correctly before they're visible in Netcare production. I know that's a lot of information. The most important takeaway here is that the clinic is not left wondering what they need to do next. All of the emails that they're receiving from their eHealth consultant outlines step by step what needs to happen. So if those emails don't get lost, the clinic shouldn't be lost.
Excellent, thanks, Chris. And I'll just reinforce, please call and bother the consultant that has your file on there. I phone Chris all the time, and sometimes I ask Chris the same question 3 times, and he's very kind. So can we just move to the next slide now? I know we're getting short on time, and so the next question as well, please, Leanne. Thanks very much for everybody who put in some questions. I'm sure if we have more questions, we can get them out to Chris or Ingrid or Brian and see if we can get some more answers. And we're just going to move on to the next one. And Schedule B, some information that Lori Choma is actually going to put on the discussion board. So we're just going to skip past the next 2 slides to be respectful of time. Just a reminder that the virtual practice facilitator training, the 1-4 fall, started September 28th, and there again is one in the winter, and you can register for those, anybody who hasn't taken the training. And just on to the next slide, please. Lori, do you want to speak to the Physician Champion Network or on Geo?
Sure. I think we talked about it last time. It relaunched on September 16th. Please share it with your physicians. It's a place for them, just like we're connecting and sharing and learning together here, a place for physician champions to do that as well. And so we have a new website. There is a summary of the last call that happened on September 16th now available on the website. So go and check it out. And if you have any questions about it, please post them on the discussion board.
And the next slide, please. Since you want to speak to this as well.
I don't know who put this one up.
Yeah. Angel?
Angel sent it to me, yes, yeah. I believe.
Okay.
Do you want to speak to it, Angel? Oh, maybe
we have lots of tech gremlins today, I think.
Yeah, I think so too. And if we could just go on to
but gremlins, I'll go just really quickly.
Yeah, thanks, Lori.
There's the new home to hospital to home guideline, and there is a draft change package. So there's a small team in ACT, and they're just looking for a small handful of practice facilitators to do a 1-hour session just to get your feedback. So if you've worked with the change package in the past, so especially the opioid change package is a great example. They just want to get your feedback on this new change package. So we'll post this one on the discussion board as well. And if you're interested in this 1-hour session and providing feedback, we'd love to hear from you.
Excellent, thanks. And because we're at 3 o'clock, we know the next Next meeting will be on November 2nd, and the topic is yet to be determined, so stay tuned for that. And I just want to say thanks again to Chris and Ingrid and Brian for joining us and sharing their wisdom with us. The information is on this page now about the Collaborate website. If you're having any trouble or you're not connected with it yet, there is the information on there to connect with that. We know the webinars are scheduled for the first Monday of each month, except if there's a holiday, and we usually hold them from 2 to 3